Hi guys, my name is Yvonne Davis. This is the first video upload for our practicum course. I will be discussing the simulation-based learning, improving knowledge and clinical judgment using a survey model. I have chosen our clinical decision unit to utilize. I will be handing out surveys I'll be doing 2 surveys and then 2 teaching methods. The first survey will getting a broad aspect or a baseline for the knowledge that each nurse has. The clinical decision unit is usually a 23-hour OBS unit, but here lately they've become the COVID unit for observations. And with that being said, we've had to utilize more codes, resuscitation methods, and which increase the acuity of the patients with COVID. So by utilizing a teaching-based model, I'll be improving the knowledge and clinical judgment of the nurses there. I have a plan to increase the use of mock codes in the clinical decision unit. I've been in contact with the clinical education instructor that is over that unit. Due to the increased acuity, we have seen an increase in patient mortality, not just in that department, but throughout the hospital. I am the house supervisor for Methodist Charlton, and I respond to each code that happens during my shift. I'm noticing that more and more of nurses are not as knowledgeable. They're not as proactive. They don't actually see the acuity and the need for a bigger knowledge base. So I'm going to try and do that in this 4 steps. The first survey will go out later this week, trying to get a baseline of all my nurses, find out what their level of experience is. I will be teaching over the crash cart drugs that are used and why we use them, how often they're administered, and then I will be teaching over the actual supplies that are in the crash cart, the central line kits, the intubation, the tubes and whatnot that we use for that. There's also like an NG tube, the CO2 monitors, adapters, and so they need to know where all this stuff is, what drawer it's in, and when to utilize it. By doing this, I'm hoping to improve knowledge, allowing these nurses to get better acquainted with the materials, problem solve, prioritize, the reason why they need to think through these situations. And all of this can be done during a mock code, so that way whenever an actual patient is involved, it should be safer for them. I will also attach the article that I'm utilizing for this week's portion of this class. I hope everyone has a good one, and good luck to you.